Okay, hi Connor. Due to various problems with people being in the same place, the same country at the same time, it's proved very difficult for us to get together with yourself and ourselves at the same time, so we've decided to present this digitally to you. This is our presentation on a virtual learning tool that we feel could supplement the learning for dental students. So just to get into it then, in terms of the rationale for what we decided to look at, we chose to look at a virtual reality game to teach dental students. And the reason that we think that this is a good resource is that studies have shown that surgeons who play video games are better and faster and less prone to errors and posing risks to their patients. So we'll also, Ben, at the end of the presentation, we'll be revisiting the ARCS model as a framework to integrate the virtual reality games into the teaching process. So we have a couple of different technologies that we looked at, and the one that we're going to talk about in detail is called the Pulse Virtual Dental Lab. We also have, as part of our instructional resource, we have a wiki space, and we're developing a YouTube channel. So the idea would be that each week we would have a new episode of the video. Edel will be presenting the first video at the end of the presentation, excuse me, and Ben will talk about the wiki space that we have also set up to complement this presentation and the learning. So basically the presentation is going to look at how to use technology to foster learning and collaboration in the digital age, because it's key to be able to foster collaboration between students, especially in the professional services. So the learning outcomes then are to develop an awareness of the benefits of gaming technology in education, an overview of the Pulse Virtual Lab, which is the one we've chosen to address, and introduction to our wiki space as an instructional resource. So what are virtual games? Well, as you probably know already, Connor, virtual reality games are where you're immersed in a realistic environment. And what we really liked about it was the fact that your actions have consequences. So games such as Second Life, Halo and World of Warcraft, and we all know that Second Life is used already as an instructional resource. So for example, your example about the pigs on the island as a way to teach statistics. So as I mentioned earlier, the surgeons who play video games are better, faster and pose less risk to their patients. And the games provide realistic scenarios to train their decision-making skills. So even though they're not in the real world, they have to prepare those skills. Also, the virtual reality is part of the mix of cutting-edge technologies like robotic instruments for microsurgery and remote-controlled surgery from a distant location where the surgeon can't physically be there. So just to go through the Pulse Virtual Lab then, this is a screenshot of the lab and how it would look. And we just have our framework down the end here, so I'm going to go through this with you now. So basically it's a virtual lab where they can practice the skills and techniques that they have studied in lectures and have been introduced to it. So it's a kind of a mediation between academic study and actual clinical practice with real patients. So students, just like in a real situation in a hospital, for example, the students will be assigned randomly different patients with different medical histories, different clinical issues, and different types of personalities, like nervous patients or aggressive patients. And they'll need to be able to react to those situations as they're happening live. So they'll be tasked with assessing the patient and deciding on the best course of action based on the clinical history for that particular patient. The advantage of this as an instructional resource is that this clinical lab is available 24/7. So if they wake up at 3 in the morning, they can get up and do some work. And also the students are encouraged to collaborate and make use of all of the resources at their disposal, including the library, additional references and their colleagues and peers. They, as part of the evaluation then, they will have to go through the process of going through a procedure with a patient, and if they make a mistake, if they drill too far into the gum, if they don't anaesthetise the patient properly, for example, there are consequences to those actions. So it all happens in a nice, safe environment, and no one is hurt during the experimentation. So we just have another screenshot there showing how you would actually drill up into the mouth. So you have to obviously use the correct techniques as well, and if you make a mistake, the patient will let you know. So our conclusion then is the virtual reality lab, this particular design by the University of Georgia, it was never designed to replace actual contact with patients, but it is a valuable resource, an additional resource that can help to supplement the learning. It's available 24/7, and it can help the students to prepare in advance of meeting and assessing real patients in the real world. What we really like about it as well is that it caters to the tech-savvy learner. They mightn't be so tuned into doing research in the library, and they might prefer to learn using computers and using the internet as a resource. And it can help to virtually prepare the students, as we said, to prepare for their clinical experience. So we do conclude that it helps to contextualize the learning, facilitates different learning styles like visual and kinesthetic learners, and aids knowledge retention. And as I said, it was never designed to replace actual clinical experience, but it certainly is a valuable resource to supplement that. So I'm going to pass over to Ben now, and Ben's going to introduce our wiki space, which is a resource to